I appreciate the opportunity to share a bit about who I am and outline the opportunities I see for the future. I couldn't be more excited to serve the people of North Carolina as the Secretary of Health and Human Services. I have dedicated my life to medicine and to public service, and I'm humbled by the tremendous responsibility and ready to roll up my sleeves. The department touches the lives of every resident of our state, and I'm happy to bring my background in medicine, in policy, and leading large, complex organization to build a healthier North Carolina. I wouldn't be sitting here today if not for my mom. She was one of the first nurse practitioners in New York State more than 40 years ago. She still works to this day in an emergency room at night. And it was through my mom's eyes where I first saw the power of medicine to touch people's lives, but it was also where I learned about the broken parts of the healthcare system. As we all know, often those broken parts show up and are magnified in the emergency room. So I entered medical school with the aspiration of bringing together clinical practice of medicine and the need for system change. And so after completing my training as a primary care doctor, my first job was at the Veterans Hospital in Washington, D.C. I was caring for women veterans while also working on policies to better integrate the care of women into the everyday operations of the larger VA health system across the country. And then, as you know, in the last 6 years, I've had the opportunity to hold several roles at the Centers for Medicare and Medicaid Services, or CMS. I joined CMS initially to work on new ways to pay for care through Medicare that would drive better care and smarter spending through the whole healthcare system. We stood up the first Medicare accountable care organizations, bundled payment initiatives, and new ways of paying for primary care. And then in 2013, when CMS experienced a major public crisis with the failure of the healthcare.gov website, my career took a different turn. I was pulled to work on the federal marketplace, and within a few months, was asked to take over as interim director. It was through this experience, and then being promoted to Chief Operating Officer and Chief of Staff for the whole CMS organization, where I learned to run a large, highly complex organization. It was where I learned to lead by cultivating issue-based teamwork, proactive communication, transparency, clear accountability, and excellence in operational execution. I work closely and constructively with a diverse array of stakeholders, members of Congress on both sides of the aisle, and I'm excited to bring those leadership lessons, as well as my policy and clinical knowledge, to bear here in North Carolina. Now, over the last 8 weeks, I've been doing a lot of listening and learning. I've traveled around the state to Burke County, to Wayne, roundtables in High Point, Mecklenburg, back here in Raleigh. I've had many one-on-one meetings here at the General Assembly with other key stakeholders, and I'm seeking to understand different perspectives and search for common ground. Having engaged in these conversations, I wanted to briefly share with you 3 areas of need that I plan to focus on in the coming months. First, as I've discussed with many of you, one of my primary areas of focus is the opioid crisis. It's ravaging our communities despite the hard work of many. DHHS must work in a more coordinated, focused, and collaborative way to address this crisis. I've already sent a letter to every prescriber in North Carolina asking for their assistance to help end this crisis, as addiction can often start with our own prescription pads. But that isn't the only solution. We need to focus on prevention and provide more access to treatment and ongoing recovery. I applaud this committee's work and the attention to this issue, and I look forward to working with you on it. I'm also focused on the changes afoot in the Medicaid system in North Carolina. The planned move to managed care has galvanized the healthcare community in exciting ways, and there are opportunities to drive more value and deliver better care to those whom the program serves. Lastly, I'm focused on accelerating improvement in the health and well-being of infants and young children, whether through direct healthcare services, child care, pre-K, early childhood education programs, or focusing on keeping at-risk children safe. We must have children get the best start in life, no matter where they live. Beyond these three core areas, there's a lot of other critical work going on at the department. I'm very focused on the mental health system and how we can make improvements. We have critical IT projects that need focused execution. I see a lot of opportunity around data and analytics. And I'm also looking at how we get more value out of every dollar we spend in both healthcare and social services by linking the social determinants of health to the delivery of healthcare. And so to close, I wanted to end on a personal note. I take my commitment to the people of North Carolina and this role very seriously. As many of you know, my husband and I have purchased a home here in Raleigh, moved our 2 young daughters, ages 2.5 and 5 here, so that I could devote myself to this endeavor. I'm a pragmatic, solution-oriented leader who's looking to partner with you to find common ground. I've managed difficult organizational change across large, complex organization, and I'm ready for this challenge. The future here in North Carolina is bright, and I look forward to working with you all as we build a healthier North Carolina together, and I look forward to your questions. Thank you.